Dzień dobry. Dzień dobry. Yes. Unfortunately, I don't speak any Polish, so it has already been hard to kind of like understand what is going on today, even though I've seen a lot of good topics coming by. Luckily, that our tool actually understands Polish, so I don't have to do it. This is really actually great that you have this kind of event. Back in Finland, there is very little of these moments where this innovation in medical sector actually come together. And I really thank you, Mikael and Jakub, for organizing this and actually like inviting us to kind of like be part of this. So let me introduce for a moment myself. So I'm Peter Smit. I'm actually Dutch, but been living for almost 20 years in Finland now. My background is really as an engineer and academic. So I studied already AI before AI was known as AI. So 2008, I started in machine learning and data mining. And after that, got a doctorate in speech and language processing. And after that, I started in Inscripta to kind of like really make these speech recognition tools so that we can help healthcare workers to kind of like do better and actually work better. I don't speak any Finnish, proper Finnish either, so I've been actually having like experience in actually building these type of tools in a language I don't know. But that's the nice thing of modern AI. You can actually build tools that actually like do the right stuff when you're having a team around you. And since 4 years, I'm actually like leading that company. So AI is everywhere, and it's really kind of like exciting. It's kind of like changing the ways that we can like do our work, that we write our documents, that we imagine kind of like, that our whole business processes and ways of working are changing because of AI, and they will. There's, of course, like a lot of different type of tools and AIs around. There's the AIs that actually really bring what they should be bringing, and there's the AIs that kind of like have a lot of promise, but not necessarily actually anything that will actually like bring something. And I think that for us, we always kind of like trying to say like, hey, focus on the AI that works. It's not only LLMs, it's not only kind of like the new GPTs, but focus on the AIs that can like really solve a problem and actually have some proof in kind of like having an impact on what it's doing. And that's of course what we are. We are like a tool that's not just kind of like basically looking at a very small process, how to input your documentation well. But the impact that it has is enormous. So therefore the title of this presentation, Small Tool, Big Impact. All right, so a bit more about like Inscripta. So as a company, really our mission is to help medical professionals from doctors, nurses, therapists, radiologists, anyone in basically like health and social care sector to not have any slides, to kind of like really kind of like do their documentation faster using speech tools. So our slogan is better with speech, because we think that actually using speech instead of typing is kind of like a more natural way to kind of like do documentation, actually like that it is much faster. So we kind of like, when we kind of like set out to do this, we really decided to kind of like start from the ground up. We built our fully own AI. Everything that we have is in-house. We're not just using a ChatGPT or like an LLM, but we have built our own speech recognition tools, meaning that we can kind of like deliver many different things. We can deliver something that has like, that is kind of like perfectionized for what it needs to be doing. If there's something wrong about it, we can actually fix it. The impact on the environment in training these is kind of like much lower than like, the bigger AIs that are around. And we're really kind of like trying to focus on something that actually works and delivers. And because we are keeping full control of kind of like the technology, this is something that we can do and also adjust to kind of like whatever use case kind of like coming around. And so the problem that we're solving is anyway, like fixing documentation. So I don't know exactly in Poland what the numbers are, but in Finland, it's easily up to half the time of a medical professional that they're spending on actually like doing documentation. Every visit, every patient interaction, anything kind of like needs to be kind of like documented well and in such a way that the patients understand it, and also kind of like then put forward in referrals and summaries. And when people are kind of like typing, they're not putting their focus on actually the content. They're focusing on how you can like spell things, how do you can like format things. Well, it's very much more natural to actually like speak instead of type. So when you speak, you're kind of like your mind is actually with the content instead of kind of like how it's being written down. And that is something that why it is also kind of like much faster too. People sometimes say, I can type much faster, and speak. But that's maybe true. but then they have to stop to think, like, what am I actually going to go and do? And then they have to do the typing. And that process, actually putting that together, makes that most people can convey things much faster while speaking than while typing. So that's basically what we have. I mean, the tool that we're having is very simple. A doctor or nurse or anyone in the healthcare sector that needs documentation grabs a microphone, any microphone, has our tool on their computer, speaks, and it ends up exactly on and the text will end up exactly on the place that people kind of need it. We don't need to integrate with anything because our tool will just act like a keyboard. So if people have their Word open or their patient record system or anything, it will just kind of like the text will come there. And that is really kind of giving that mental bandwidth. You don't have to worry about anything. You just click, you speak, it types for you. So in Finland, I mean, we have like a lot of kind of like promising testimonials that kind of like show how much time people save. One of the early ones, this was already 3 years ago when the product was, doing 97% accuracy. This doctor, Jonne Wilkman, he was saving eventually 75 minutes a day just by being able to kind of like type instead of speak. And that is basically, I mean, that is his story. This is not ours. And the way this worked was, for him, this is maybe a bit more related to Finland, but you'll have similar processes as well. He had every 20 minutes a patient coming in. And he would actually spend time with these patients. And then after it, he would have to kind of like, the patient would leave and he had like only a few minutes to do his documentation. Those few minutes were not enough to finish actually doing his work. So he would kind of like make a couple of quick scribbles. And on the end of the day, when he had like all these patients and at 4 o'clock, he would actually start writing and actually like doing his work. And then, 1.5 hours later, he would actually be able to get ready to go home. Now, what he does instead is, it's not anymore any 20 minutes, but every 18 minutes he has a new patient, or every 15 minutes, I don't know exactly how he does it. But because he is doing speech recognition, he can finalize his documentation right after every visit and actually making it happen. Meaning that he is actually having, on the end of the day, when at 4 o'clock, he has done more patients and he has no documentation to be doing anymore. And that is kind of like the AI that works, something that actually goes forward. In Finland, we have actually grown over the past 4 years. So 4 years ago, we launched this product, and now we are basically covering over half the country. So all the public regions, the biggest private healthcare providers are all using our tools to actually like do this documentation. And we have really kind of like made certain that it's not just top doctors, but that we are really, and radiologists, but that we have really a tool that's affordable so that anyone in these organizations is able to get access to it. Not everyone uses it, and that's all right, but everyone has the possibility of using a speech recognition tool and actually saving their time and their work. Also, the lower paid nurses or therapists that normally wouldn't have access to these type of tools. And now we're really kind of like on this phase that we're going to the first of foreign countries. So you see the countries in pink, including Poland, are kind of like our first wave of countries where we will be expanding to. Our technology is fully language agnostic, and we only need like a small 1 to 2 months phase to actually like adapt. And we really are seeing kind of like the potential in these countries, including in Poland, to kind of like bring the tool here and help here with the healthcare processes as well, to kind of like make them better with speech recognition. This is kind of like our user graph. I mean, it doesn't have any kind of like lines, but I can tell you that we're over 10,000 users in Finland at the moment. And the scale is correct, so we basically have grown all those users in the past, basically 2 years. And at this moment, based on the survey, our users on average save 45 minutes, so up to 2 hours, but the average is 45 minutes, meaning that we basically save 450,000 minutes a day. That's the equivalent of 100 doctors. So what tool can this actually do? That it actually saves 100 doctors of time in a country. That means that the doctors actually can, focus more on their work. They have less mental stress themselves. They can actually focus on the patients, or they can just help more patients. And this is really what we are kind of like trying to bring to the country. And that's what I said, small tool, big impact. Judge AI by the impact that it's having. And this AI is having this impact in Finland already, and is coming here to kind of like Poland next. So yes, Poland is one of our next countries that we're kind of like rolling out to. So together with Jakob and Mikael, we have already kind of like identified kind of like some first partners, and we're still looking kind of like for more, which we can launch the product. We have first like a localization phase where we can like need for 8 weeks, 3 months, like get the product fully ready so that it also understands fully medical vocabulary. And we're expecting to really launch generally available in the second quarter of 2026. And then this product will be really available all of Finland for all medical specialties, for all persons in social and healthcare to actually like go further with. So yeah, if you're interested in partnering with us already kind of like in the localization phase, or like interested in taking this tool into use kind of like after that, talk to me or to Lasse, my colleague in the back, or just to Jacob and Mikael, and they will put us in contact, and we can kind of like together really save time for our healthcare professionals so that they can be both happier in the job, help more patients, and actually like bring healthcare further. So yeah, AI is exciting. It changes the way we work, also in medical, and AI that actually works is here. So yeah, thank you.